want to talk about the issue of funding in terms of the WaterAid programs across the region. How do they go about it, and who determines who's going to get what? Which country is going to have what programs to be implemented and so on?
Okay.
Yeah.
Good. So WaterAid in Southern Africa is we have set programs which countries set based on what are the needs for that country. So countries spend a lot of time analyzing the context and then coming up with programs which could be funded by WaterAid. But as well as WaterAid, we have targeted country programs which we choose to work in. So let's say for Southern Africa, currently we are present in 6 countries because from the start we look at the need, we look at some of the gaps which are in that society, and then we say we'll invest in those societies for a number of years where we'll work in. So it's based on different scenarios, the context, the need, and as well our ability to then intervene in such kind of a country.
Okay, so in those 6 countries within the region that you have mentioned, what are the programs that you're currently implementing which have made a great impact in terms of the water health sanitation programs?
So we do quite a number of programs which as well is dependent on the country. So if we are to talk regionally, if you had to go to a country like Zambia, you'll realize that we focus more on working in what we call water sanitation and hygiene in healthcare facilities. We're also working in ensuring that schools have water sanitation hygiene services. So our biggest program will focus on those portfolios. But as well, we'll do more like community-based projects to support communities to have water projects. But that will not be just a borehole and all, but we'll put actually like piped water systems, which will then support communities to have sustained water and be able to connect hospitals, police camps, and other services. But as well, if you go to countries like Malawi, you will find as well us focusing more on more like projects in small towns, like some people call shanty towns, where they will not have access, we could build there. But as well, we focus more on working in institutions like hospitals and all. But as well, a bit of more in communities. But our biggest focus now in countries like Malawi is making sure that all the healthcare facilities in Malawi have adequate water sanitation, working with other partners. So I think I can go country by country, but most of it is dependent on the context and the greatest need. So we don't want to go in there and just do any water project, but we want to look at what is the gap and we focus on. So could it be in schools in other countries? Could it be in communities? Could it be in small towns? Could it be in... it depends on the context of the country.